Conrad, you
Hello
have a
everyone,
message.
welcome again to this YouTube channel and welcome to another presentation where we are going to be continuing with pediatric pathologies. My name is Ewube Gloria. Today we are going to be taking the third pediatric pathology. We are going to be discussing on anemia in children. Our outline is going to run as usual from definition to conclusion. We're going to be discussing the definition, the pathophysiology, the causes, the risk factors, the signs and symptoms, the treatment, diagnosis, nursing management and intervention, prevention, and we are going to conclude on this topic. So let us begin. Let us discuss about the definition of anemia. Anemia is usually referred to as shortage of blood in a layman's term. What is anemia? Anemia is a disease or a condition that is characterized by low red blood cells or hemoglobin in blood. It can also be defined as a hemoglobin level of 9 grams per deciliter or lesser than. As we all know, hemoglobin is a protein that carries oxygen, and if there is a low hemoglobin level, it can lead to the tissues of the body being deprived by oxygen, and this could cause them to suffer from hypoxia. Moving now to the pathophysiology of anemia. The pathophysiology lies in three main mechanisms that occur in the body. First, we have the decrease of production of red blood cells. This might be due to a fault in the bone marrow, as we know that the bone marrow is one of the centers where red blood cells are being produced. Next, we have an increase in the destruction of red blood cells, also known as hemolysis. Here, it can be caused due to disease conditions like infections in the body. It can also be caused due to chronic conditions like kidney disease, even malaria, and it can also be caused by hereditary diseases like thalassemia and sickle cell disease. The next we have blood loss. This is hemorrhage, maybe during accident or severe wounds, which will cause excessive blood loss and lead the patient to anemia. Moving now to the causes of anemia. As earlier mentioned, we have chronic diseases like the kidney problems. We have also cancer. We have hereditary diseases. We also have autoimmune responses of the body where the body attacks its own self. We have nutritional deficiencies. Here the child might lack some important vitamins which will help in the production of red blood cells and may lead to a type of anemia. It can lead to iron deficiency anemia as lack of iron intake in the child's diet. It can also lead to pernicious anemia, which is lack of vitamin B12 in the diet of the child. We also have genetic disorders like earlier mentioned sickle cell and alpha and beta thalassemia. And we have infections. Now, for the risk factors of anemia, one of the main risk factors is poor nutrition, as most children who suffer from anemia is usually due to deficient in supplements which lead to their anemia. Another risk factor is disease condition. We also have family history, as if there is a family history of hereditary blood issues or anemias like sickle cell disease, thalassemia, it might also affect the child. As another point under risk factors, we also have environmental conditions where if the condition is if the environment has a type of condition where it allows breathing space, for example mosquitoes, this is going to cause a high rate of malaria, and malaria can cause the hemolytic breakdown of red blood cells, causing anemia. We also have infections. We also have living in high altitudes, as this causes reduction of oxygen. Premature birth is another risk factor of anemia, as children that are born prematurely may not have all the developed red blood cells. Their red blood cells might not be fully developed, or they might have a reduced level of red blood cells, hence causing them to be anemic. Moving now to the signs and symptoms of anemia. The list of the signs and symptoms of anemia are unexhaustive. As seen in the image below, we have some few common ones, which are cold palms, like cold skin. We have dizziness or lightheadedness. We have fatigue and weakness. And so on and so forth. Moving to the treatment of anemia will vary with each patient depending on the severity of the case. But in general, we have treatments like vitamin supplementations, where the child is going to be given vitamin supplements to be taken to be able to balance with those not being absorbed through food. We also have iron supplements, which we know iron is one of the main molecules that help in blood building. We also have dietary changes, where the physician or the nurse might tell the patient, may give or implement diets rich in iron and these vitamins that are going to help the child falling into an anemic condition. We also have management of underlying condition, be it an infection, be it any other disease condition that is causing the child to be anemic. This should be treated in order to avoid the anemia. And then in severe cases or in cases where it is necessary, blood transfusion is being given. For the diagnosis, we have three main diagnoses listed here below. We have the peripheral blood smear. This is used to evaluate the morphology or the shape of the red blood cells. We also have complete blood count, CBC, which will be able to determine the level of the hemoglobin level of the child more specifically. And we also have additional tests like electrophoresis, which are going to be important to determine if this child has any other hereditary blood disorders. For the nursing intervention and management, we have as first rule and as usual rule to monitor the vital signs of the child, as this will serve as a baseline monitoring data to know if the child is recovering or not and to take proper actions. We also have secure an IV line if necessary for any parenteral medication that is going to be prescribed by the physician, but if not, then this management is not necessary. We have as intervention to ensure adequate hydration and nutrition of the child. These two things are going to play a very important role in the recovery of the child from this condition. And last but not the least, we are going to be educating the caregivers, be it the caregivers, the guardians, the parents of this child, on the sources of iron, the sources of vitamin that this child is going to have in order not to fall into anemic crisis. Now, how are we going to be preventing anemia in children? First, we are going to be preventing it by educating the caregivers, educating the parents out there on nutrition. We are going to be teaching them about the importance of nutrition, the different sources of food, and the different nutrients they can bring to the child. We are going to be emphasizing on the nutrients that are going to help prevent anemia. Nutrients like iron, like vitamin B12, and others. Next, we are going to be preventing this disease by screening. In screening, in the sense that the hemoglobin level of these children will be checked frequently, at least 2 times a year, in order to know if this child is susceptible to an anemic crisis or an anemic shock anytime soon. Next, we have breastfeeding, as breastfeeding is going to help the child have more nutrients because there are more nutrients found in the breast milk. So a child who undergoes exclusive breastfeeding specifically is going to have more nutrients and then to have a more healthy life. And we have the prevention of other preventable diseases like malaria early mentioned. If we keep our environment neat and avoid breeding spaces for the malaria parasite, then we are going to free these children from diseases like this which can cause malaria. In conclusion, anemia is a condition that is manageable with proper treatment and proper care. All we have to do is to create awareness of the risk factors of anemia, and so that we'll be able to early detect it and early treat this condition, as this condition can be life-threatening too if not properly taken care. We have come to the end of this session, anemia in children. I hope you all enjoyed the video, and I hope you all had a proper and a brief understanding of what was given here today. Thank you for watching the video, and see you in the next session.